This is your introduction to TCD, or Transcranial Doppler, with NeuraSignal. TCD is used all around the world, and the most common application is sickle cell disease. Secondly to sickle cell is vasospasm, and then the list continues. We can do TCD for right to left shunt for a PFO, for intracranial stenosis, for emboli monitoring, for brain death verification, moya, carotid artery disease. With TCD, we use a 2 megahertz pulsed wave transducer, and we'll place it at the temporal windows. We will use 4 different windows when doing a complete TCD. Today, we're going to focus on just one window, and that's the temporal window. We're going to want to get through the thinnest layer of bone and place the probe at window 1. 85–90% of the time you place that probe here right in front of the ear on an adult patient and angled towards the opposite eyebrow, you will isolate your middle cerebral artery. Windows 1 and window 3 are your most common windows for your pediatric patients. For your challenging patients, you can look for windows 2 and window 4. What you'll see on your TCD screen will be a motion mode, M mode, and your spectrogram. To break down what this means is your M mode is displaying flow towards and away from the probe. If the blood flow is towards the probe, it'll present as red. If it's away from the probe, it'll present as blue. You can see so many depths in M mode. So you can see from 30 to 80 plus millimeters. This is very important because we know that an adult skull midline is generally at 75 or 80 millimeters. So when you are looking on one side of the head, you can see all the way to the other side. To compare the adult skull with the M mode, you will have the probe at the skin surface, and the top of the M mode will be the top of the skin surface. And as you travel deeper into the base of the brain, you'll travel deeper into the M mode. So you can see your middle cerebral artery here at 60 millimeters coming out towards the probe to 30 millimeters. So you can see that also here on the M mode at 60 millimeters, this is your middle cerebral artery coming out towards the probe. The ACA is going away from the probe, as you see here. So you'll see that in blue going away from the probe from 60 to 75 millimeters. On the other side of the head, as we said, midline, about 75 to 80 millimeters for an adult patient. So here you see 75 millimeters is the midline. When you travel to the other side of the head from this window, you will see that blood flow reverse direction because you're looking on this side. This red flow from 75 to 85 millimeters is the other side ACA. And as you travel even deeper, at 85 plus millimeters is your MCA on the other side of the head. Here is our circle of Willis layout, as you'll see on the reports. We have our ICA, MCA, ACA, and same thing on the other side, our ICA, MCA, ACA, our vertebrals and basilar. There will be the depth the image was taken on the side with the vessel label, the mean velocity, and the pulsatility index will be included. Our Lindegaard ratios will also be included for our vasospasm patients, but what the images will appear as is that M mode that we saw on the prior screen along with our spectrogram. We will change our depth along this M mode band to isolate the different vessels that we're looking at. And the spectrogram will be above the baseline for blood flow coming towards the probe and below the baseline for blood flow that's going away from the probe. So here you'll see is our MCA and here is our ACA. ACA on the other side, MCA on the other side, and here is our PCA 1 segment and PCA 2 segment. With TCD, we're looking at the mean. This is the time average mean maximum. What that equation is 1 peak plus 2 ends divided by 3. And this is an average over 4 cardiac cycles. So you'll have 4 beats. It will take the mean flow velocity of these 4 cardiac cycles. Along with the mean flow velocity, we'll also look at the pulsatility index, or PI. A high PI is 1.2 and above, so you can see the loss or lack of end-diastolic flow will be your higher pulsatility index. If you find this type of signal in all intracranial vessels, this would suggest brain death. Here is another example of a high PI, a normal waveform with which you'll find in a middle cerebral artery. PI of 0.8 or 1.2 will appear as this image here. A lower PI, 0.4, you'll have more end-diastolic flow. Your PI will also change when a narrowing or stenosis presents. So there will be a higher PI before the narrowing or vasospasm. Your lower PI, high mean, at the area of narrowing, and then a lower mean and a low PI after a narrowed segment. Now we'll walk through what each vessel will look like on the screen. Our bread and butter of TCD is our middle cerebral artery. This is the largest vessel that we can find with transcranial Doppler and should be the easiest one to find. So we will attempt to find this vessel first when starting a TCD. When we have the probe on the side of the patient's head, the temporal window, we should be able to see a large range of that vessel because we can see so much of this vessel coming towards the probe. This is the largest segment, largest vessel between these depths of 60 and 30 millimeters here. So here's our probe on the side of the head. We're at 30 millimeters. We should be able to see the whole length of this MCA all the way to 60 millimeters where the proximal portion is. So you'll see the same thing aligned here. Here is 30 millimeters and here is 60. We can see all that blood flow towards the probe. It is the only vessel that we can see so much of, and that is why we should think of big red when you think of your middle cerebral artery. It is your big red band. It is the only vessel you're going to see all this red blood flow coming towards the probe is your middle cerebral artery. If you align your probe to obtain your middle cerebral artery and anterior cerebral artery together, you'll see that big red band touch the little blue band, and you'll have your MCA and ACA together. Moving right along to our ACA, or anterior cerebral artery. Ideally, you'll find your MCA first, and you will angle accordingly. Sometimes it's a bit more superior, anterior from MCA. You will see that red band, that big red band for your MCA, and it'll be attached to that blue band. That blue flow, or the blood flow going away from the probe, your ACA, generally lives between 60 and 75 millimeters. Here is your ACA, between 60 and 75 millimeters, aligned with the probe. Here's your ACA. And we know it is going away from the probe, so it'll be blue in the M mode, and it'll be below the baseline in your spectrogram. Moving right along, the next vessel to identify is your terminal ICA. From your MCA-ACA bifurcation, you will angle inferiorly. Start turning that probe slightly towards the patient's chin. And once you start turning the probe towards the patient's chin, you will see that that blue ACA will start to disappear and red will appear where the blue was. Because what's going to happen is when you're angling towards the chin, you will identify that terminal ICA here. It should be deeper than that middle cerebral artery. You'll have to look between the depths of 60 and 70 millimeters, and that flow should be coming up towards the probe. And what will happen is on your M mode, you can also identify the other side terminal ICA. And what will happen is we know that there are no vessels between the ICAs and the neck. So what you'll see the ICA on one side, there'll be no flow between the ICAs, and then you'll see the ICA on the other side. So 12 to 14 millimeter gap between your ICAs, blood flow towards the probe between 60 and 70 millimeters will be your terminal ICA. The PCA, or posterior cerebral artery, is the last of the 4 temporal window vessels we will review. So your PCA is a posterior inferior rotation from your MCA-ACA bifurcation. So here's your probe on the side of the head. You will angle posteriorly, inferiorly from MCA-ACA bifurcation. Identify that PCA, that small PCA back there between 60 and 70 millimeters. This portion of the PCA is coming towards the probe, so you see it in red here. If you do identify the blue band attached to that red band on your TCD when you're looking for your PCA, that blue band that you see here is your other side PCA. These are your P1 segments bilaterally. A lot of people get confused and think that it's possible we can see P1 and P2 here. That is not the case with TCD dedicated Doppler. These are your P1 segments bilaterally. And here is a side-by-side comparison of anterior versus posterior. The things to look for your big red band. This is your MCA. This is anterior flow. See that little red band? This is your PCA. Look where the red and blue meet. Your anterior red and blue, MCA and ACA, will typically meet at a depth of 62 millimeters. Your PCA, bilateral PCAs, will meet at a depth of 70 millimeters. If this is at 62 and this is at 70, that is another indicator this is anterior and this is posterior. At a normal state, the mean flow velocity in your anterior MCA is going to be higher than your posterior PCA flow. Look for the big red band, look for the higher mean. Start using the sound. Listen for the high pitch sound of your anterior flow versus the low pitch sound of your posterior flow. And here is some practice. If you were to see this screen, you're looking bilaterally. This is your right side, this is your left side. What are these M mode patterns? What is this telling us? Would you suspect this is your MCA and ACA? Would you suspect this is your MCA and ACA? What depth range is this? We're looking from 30 to 80. Here's our 80. So here's our 75. This is our midline right here. So would it make sense for this to be ACA if it's deeper than midline? We can confirm this is our MCA here. We have our big red band, our right MCA, our big red band, our left MCA. We can see more red here on the right, deeper than we can on the left. So we can see at 60 millimeters, we can see blue on this side. So 60 millimeters is a typical bifurcation of our MCA and ACA. So this we can confirm is our MCA-ACA bifurcation, 60 to 70 depth for our ACA. On our other side though, from 60 to 70 is red. This would not be our ACA. This would be our terminal ICA. The probe is angled where we're getting more of our terminal ICA and not our ACA. So if we're getting our MCA and ACA and then there's a gap before another vessel, what did we say? A 12 to 14 millimeter gap typically between our ICAs, and this would be the other side ICA. That is all we have for today. Thanks for your time and attention.